Hello, I'm Bob Duffy, and welcome to this episode of Innovating at Home, a video series where we talk with developers about how they're coping with the COVID pandemic and how they are innovating at home with sustainable solutions, helping themselves and their communities. In this episode, we're talking with Indranil Chandra, the founder of the M19 Initiative. This is a maker community where they are redefining the concept of manufacturing and distribution with one simple goal: to help health professionals during the pandemic. Indranil, welcome to the show.
Thank you, Bob. Thank you for having me here.
Well, I'm really glad to have you here, and I want our audience to hear this like I heard it. So let's just start from the beginning. The COVID-19 pandemic hits. What's happening with you, and what are you thinking?
So I was just like all the other developers out there. I was doing my own tasks, probably upskilling myself, learning about new stuff. But there was one catch which was there, that all of my close friends are actually resident doctors. And by resident doctors, I mean the ones who are working there at ground zero, dealing with the COVID positive patients and even the suspected patients directly. Now, I clearly remember on one weekend, I get a call from one of my friends who is a resident doctor in one of the hospitals in another city. And she called me up asking for help, whether I can help them with some sort of a PPE equipment or face shields or mask or whatever I can.
Yeah, and what I understand is you started to look at various solutions like printing masks.
Now, the only problem with manufacturing N95 masks is it requires a very specific type of clothing. It requires a very specific type of fabric through using which you can actually manufacture those masks. And obviously, because of the lockdown situation panning out in India, in our country, it was very difficult to get hold of those fabric, and obviously importing it from another city or another country was not a possible solution. That's one way of looking at the problem. Now, obviously, this was not a feasible solution. Now, we went ahead with the second approach to solution, which was, let's try to increase the shelf life of this 10 masks that we have so that this can be increased over a prolonged period. And in the meanwhile, all the infrastructure facility, the distribution facility, and the government authorities can scale up everything up and bridge that supply-demand gap, right? Now, one obvious way to solve that was obviously, we started manufacturing the face shields. Now, face shields are basically a transparent layer or a transparent cover in front of your face, which helps, takes the impact of all the respiratory droplets which are around you and reduces the exposure that your N95 masks take, right? Now, the good part about this face shields were it could have been easily, after each use, you can just remove it, you can sanitize it, you can, wash it, rinse it, and it's again ready for new use. You can use it again. So that's how we went about the solutioning approach to this. This was one part of the problem, right? So we solved the manufacturing part. How do we really go about this solutioning? Now, obviously, there was one more bigger part of the problem, which was the distribution bit, which was again an interesting part of the story.
Yeah, so that's amazing. So obviously people might have gone right to thinking N95 masks, but obviously you've got a distribution problem, you've got a sustainability problem, you've got to make sure that these things can work over a long period of time. And so you ended up at the 3D printed face shields. So this would be difficult for one person to do, but from what I understand, you started to involve your community, not only in the printing, but in the iteration and the design of these things. So tell us about how you got the community involved.
We were discussing, a couple of our friends, and we are all part of the maker community here in India, and we have been in contact with each other since a decade now. We all know each other. So I called up a couple of friends, and I came to know that many of them were already solving this kind of problem. They were already, manufacturing face shields in their local maker spaces and distributing it locally. And while chatting, we came up with a solution. Why don't we try to, proceed with distributed manufacturing? Then the entire distribution problem goes out of the picture, because you are manufacturing the units there and transferring it locally within your community, so that it's far more easy and far more sustainable in that way to carry it out or to execute it. We had one fab lab which was present in that city where my friend had asked for help. I was good friend with the co-founder of Fab Lab Nagpur, Mr. Pratik Gadkar. I called him up and asked for help, and he immediately came on board. We could quickly, create the first prototype. We went to the hospital, got it validated by the doctors, and on that day itself, we received an order for 1,000 face shields to be delivered over the course of next 2 days.
Wow. And so I think I heard you say that the first week you distributed 1,000 face shields. So talk a little bit about that. How many were you able to produce that first round? And then what was the reaction like when you dropped these off at a health clinic and hospital?
We actually distributed 1,000 facial in the first 3 days itself. Fab Lab Nagpur itself distributed in the first 3 days itself. Now, obviously on the first day, we could only manufacture 300 facials. We had a late nighter obviously that night, and I woke up the next day and I was receiving this photos and pictures from all the healthcare workers and the doctors, expressing their gratitude and thanking me for providing them with this basic protection. And I was getting these pictures. I woke up to this beautiful picture of one of the of couple of doctors actually treating a COVID positive patient and were wearing the face shields. And it was really a good morning that day. It was really a good morning. So we produced 300 face shields the first day. Second day we scaled up to 800. Now, while all of this was happening in Fab Lab Nagpur, meanwhile, there was something else also panning up in the background, right? So all of us, all of the makers were getting in touch with each other. We got to know that all of us are doing this. So we kind of started collaborating and sharing ideas with each other on how we can scale up the production line. And we could scale it up very quickly from there.
Yeah. So that first 1,000 face shields, that's in your own backyard, that's in your local community, but you didn't stop there. I mean, a lot of people would think, okay, I've done this, I share it on Facebook, look at the good thing I did, but you continued and you expanded beyond that one city. Tell us how you scaled.
So I very particularly remember I used to receive some 100 odd calls in a single day during those times. And there were two types of people whom I used to coordinate with. One was obviously other fab labs and maker spaces who were also trying to scale it up, who were also trying to help the local community. And the second type of people were obviously the doctors, the hospital authorities, and the civic authorities. All of us came together and we formed this initiative called N19 Initiative. N stands for maker, and 19 basically signifies COVID-19. So we came up with this initiative. We kind of channelized all the efforts which were being undertaken by various makerspaces and fab labs, and we collaborated and we kind of came on a common platform wherein we took it to the next level. And we took it to a level wherein from the day we started, within 49 days, we had distributed 1 million face shields across the country. And there were 40 plus labs and maker spaces who were on board with us. We were distributing across 25 odd cities and villages.
Okay, so you go from 1,000 in the first 3 days to then in 49 days, did I have that right? A million in 25 cities. Yes. That's absolutely incredible. I mean, that's a totally different way of doing manufacturing and distribution than what people would normally think about. I mean, it's the maker model that people really kind of like, but we haven't actually seen that work in production at that scale. So did anybody take notice of this? Because this is a really interesting case study.
Yes. So we have been approached. In fact, Makers Asylum Mumbai has been approached by Cambridge University, couple of researchers from Cambridge University who are conducting a study on this distributed manufacturing feat that we have achieved together, right? And there's a detailed study which is being carried out by Cambridge University. Also, recently, a detailed study has been published by open source medical supplies community as well, the OSMS, which is again a global community, and they have also recently published a very detailed study on how we scale it up.
Wow, amazing story. N19 initiative is fantastic. You're moving from one thing now to others. So it sounds like it's got a long life and it can do much more.
And in fact, not just facials, over a period of time, some of these labs and makerspaces have diversified into making a lot more things, right? So Fab Lab Nagpur started also manufacturing aerosol boxes, sanitizing tunnel, pedal operated as well as sensor based sanitizer dispenser, COVID testing van. Makers Asylum started producing positive air pressure respirator masks and claws and whatnot. And yeah, we have been receiving a lot of support from the civic authorities, from the local communities, from the hospital authorities, and that's what is helping us scale even further.
And this is really a true case study on people, groups, and communities working together to do something amazing that probably nobody would have thought could be done. So just fantastic work. Congratulations on that. But before we wrap this up, what's going on with the M19 initiative now, and how can people learn more about it?
So as I've said before, all of us have diversified into a lot of other solutions now. Obviously, all the labs are taking it up, as per the local demands and everything, as and when it is coming up. Now that the government officials and the health officials and the civic authorities have scaled up and have met that supply demand gap, we are still doing it, but in a less aggressive way is what I would say. If you want to learn more about our initiative, you can always go to the Makers Asylum website, or you can check out the fundraiser campaign that we had running, which has all the day by day documentation of how we went about things. And that link you can follow bit.ly/COVID-19 warriors, and you can get all the details over there.
Excellent. We will put that link below in the description. So, Indranil, thank you for joining us. It's an amazing story.
Thank you, Bob, for having me and inviting me here.
If you want to learn more about the M19 initiative, follow the link below. And if you like videos like this, subscribe to the Intel Software YouTube channel. Well, that wraps up this episode of Innovating at Home. I want to thank my virtual production crew. I want to thank you for joining us. And until next time, I'm your host, Bob Duffy, and we'll see you innovating at home.